How to understand liver enzyme test normal ranges. Imagine your liver as a busy factory, constantly working to process nutrients, remove waste, and keep your body running smoothly. When there's trouble in this factory, certain enzymes leak into your bloodstream, giving clues about how well your liver is doing. Liver enzyme tests measure these enzymes to help assess your liver health. The main enzymes checked are alanine aminotransferase and aspartate aminotransferase. These enzymes are usually inside liver cells but can spill out if the liver is inflamed or damaged. Understanding what the normal ranges are and what deviations mean helps doctors figure out if your liver is healthy or if further tests are needed. Let's start with the basics. Alanine aminotransferase, or ALT, is an enzyme that helps with amino acid processing and is mostly found in the liver. When liver cells get hurt, ALT levels in the blood go up. The normal range for ALT is generally between 7 and 55 units per liter. Aspartate aminotransferase, or AST, is another enzyme involved in amino acid metabolism. It is found in the liver but also in other tissues like the heart and muscles. Its normal range is usually between 8 and 48 units per liter. These ranges can vary slightly depending on the lab, your age, sex, and body size, but these numbers give a good general idea. Other parts of liver function tests include alkaline phosphatase, albumin, and bilirubin. Alkaline phosphatase helps evaluate bile duct health, while albumin reflects the liver's ability to produce proteins. Bilirubin measures how well your liver processes waste products. Normal levels for alkaline phosphatase are about 40 to 129 units per liter. Albumin should be between 3.5 and 5 grams per deciliter, and bilirubin is normally between 0.1 and 1.2 milligrams per deciliter. When your test results come back, slight elevations of ALT or AST, say up to 2 or 3 times the upper limit, may suggest mild liver inflammation or injury. Larger increases, especially over 1,000 units per liter, are rare but often point to more serious issues like viral hepatitis or significant liver damage from medication or other causes. The ratio of AST to ALT can also provide clues. If the AST level is higher than ALT, it might suggest alcohol-related liver injury, especially if the ratio exceeds 2. If ALT is higher, it might be linked to fatty liver disease or other non-alcoholic conditions. It's important to remember that liver enzyme levels alone do not give a complete picture. Elevated enzymes indicate liver cell stress or damage but do not specify the cause. Other factors like chronic liver disease, medication use, or muscle injury can also influence these levels. That's why doctors interpret these results in the context of your symptoms, medical history, and other tests. Sometimes additional testing like imaging or blood tests for viral infections is needed to get the full story. Keep in mind that normal ranges can differ between laboratories because of different testing methods. Also, some non-liver conditions can raise AST or ALT levels, so these tests are just one part of the overall assessment. If your liver enzymes are abnormal, your healthcare provider will guide you on the next steps, which may include lifestyle changes, further testing, or specialist referral. Regular monitoring of liver enzymes is helpful, especially if you have risk factors like hepatitis, fatty liver, or cirrhosis, as early detection can prevent more serious problems, including liver cancer. In summary, understanding liver enzyme test normal ranges helps you recognize when your liver might be under stress. ALT and AST are the primary enzymes measured, with typical normal values around 7 to 55 units per liter for ALT and 8 to 40 units per liter for AST. Deviations from these ranges suggest liver stress or damage, but always remember that interpretation depends on your overall health, symptoms, and additional tests. If you have concerns about your liver health, consult a healthcare professional who can provide personalized advice based on your specific situation.